Harm Reduction 101, and it's really meant to be a practical guide for providers in New Mexico. That being said, I know we have guests from outside of New Mexico, which is fantastic. A lot of what we talk about today can be applied to other places as well too. There's just some specific resources that are aligned more so with New Mexico, but it doesn't mean that, the approach that we discussed today can't be implemented elsewhere. And as we, go forward with this talk, I just want to make a quick comment too that, harm reduction is deeply rooted in community, in particular people who have lived a substance use experience and really want to help others with substance use. I am a person without lived experience, and I want to acknowledge that before I approach this subject with you all today. But I know many of you providers may be in the same boat as I am, specifically may also not have lived experience, but want to implement harm reduction into their clinical practice. And I think this kind of helps kind of guide that implementation. So I don't have any disclosures for today. So we have three learning objectives for this discussion. The first is to define harm reduction and then review the core principles of harm reduction. The second is to briefly review the evidence that supports harm reduction. And then lastly, demonstrate how you as an MOUD provider can actually apply harm reduction into your clinical practice. So first, let's talk a little bit about harm reduction. And let's ask that by asking a question. You can answer in the chat, or if you're not camera shy, go ahead and raise your hand. You can answer here too. But we're at the tail end of the summer. We're getting close to fall, but still many of us spend time outdoors. When you are outside, do you all use sunscreen? You can put it in the chat. I'm trying to monitor the chat. Only in my makeup. Yes, always, not enough. Yeah, I have to wear lotion that has it too. But yeah, you may not realize this as a provider, but you are probably already talking about harm reduction all the time in your clinical practice. So like recommending sunscreen when you're outside is just one easy example of this. We know that exposure to UV light can increase the risk of skin cancer, but being outdoors is also really enjoyable. It's usually linked to healthy activities as well. But we don't ask people to stop going outside, right? We tell them, hey, to minimize their exposure, start wearing sunscreen. And that in and of itself, if you can understand that, is the essence of harm reduction, right? It's minimizing the negative health risk without completely eliminating exposure. If you look at the National Harm Reduction Coalition, they define harm reduction as a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. It is also a movement for social justice built on a belief in and respect for the rights of people who use drugs. And I think that's a nice way to put it. When you look at harm reduction, there are 6 core principles that kind of set up the foundation for harm reduction. And they include pragmatism, a focus on harms, emphasis on human rights, involvement of people with lived experience and people who use drugs, and maximizing options and focusing on immediate goals. So let's take a deeper dive into each one of these different core principles. So the first is pragmatism. So in simple terms, pragmatism is a way of thinking that focuses on practical results and solutions rather than abstract theories or ideals. So really emphasizing what works in the real world. In harm reduction, this means that for better or worse, substance use is part of our world, and we should focus on minimizing harm rather than ignoring or condemning it. It also means that substance use is on a continuum and that some ways of using substances are safer than others. When we talk about focus on harms, this means harm reduction establishes that the quality of the individual, not complete cessation, is what drives success. But at the same time, it does not attempt to minimize or ignore the harms from substance use. It does actually, acknowledge those facts. There's also an emphasis on human rights with harm reduction. So harm reduction calls for non-judgmental and non-coercive service delivery. No judgment is made to condemn or even support substance use. It's really just there to focus on reducing risk and supporting personal choice. And harm reduction also involves people with lived experience, like I mentioned before, and those who use drugs to ensure that they have a voice in the services they receive and the service delivery itself. So, harm reduction also affirms that people with lived experience or those who use drugs should be empowered to support each other and join providers in determining the best interventions to reduce harms. This is essentially, bringing in patients into the fold when it comes to decision making. The other core component of harm reduction is maximizing options. So, harm reduction should include a variety of options, and these options should be tailored to the individual. This includes safe supply and overdose preventions. We're going to talk about all those things here in a minute. But in fact, I think the other concept to kind of attach to this is that harm reduction should not be isolated from medical services. In fact, it should be integrated. And that's why I'm so happy and thankful that you all are here on listening on how to do that today. And then harm reduction also acknowledges that many factors, such as poverty, class, racism, social isolation, trauma, discrimination, all these social inequities profoundly influence a person's vulnerability to harm and their ability to effectively address it. So, harm reduction is really meeting people where they're at and establishing achievable goals that they can build upon over time. So, we went through all those core principles, but I think it's really important to kind of tie that into maybe some of the language that us as providers kind of think, or some of the resources we may be more familiar with. And these core principles are directly aligned with existing best practices for substance use disorder treatment, including patient-centered care, trauma-informed care, motivational interviewing, and advocacy. And this kind of chart here shows how they kind of directly align with SAMHSA's, principles of harm reduction, how they align to best practices. So, for example, providing support without judgment directly aligns with patient-centered care, and practicing acceptance is a key component of trauma-informed care. So these are all kind of evidence-based things in and of itself. And I want to take just a quick moment here to talk about the idea of enabling. So oftentimes critics of harm reduction may state that harm reduction is a form of enabling. And I wanted to share this quote from the Deputy Director for the National Harm Reduction Coalition that really, I think, helps address this concern. I'm just going to read it verbatim. I got into harm reduction to enable people who use drugs. I enable them to protect themselves and their communities from HIV and hepatitis C and overdose. I enable them to feel like they are someone to talk to, someone who cares, someone who respects them and their humanity. I enable them to ask for help and to help others in turn. I enable them to find drug treatment and health care, to reconnect with their families, to rebuild their lives. And I enable people who use drugs to take personal responsibility for their health and their futures. If that makes me an enabler, I'm proud to claim that term. So also I want to take a moment here to kind of think about substance use, the substance use spectrum, and emphasize that substance use exists along this spectrum, ranging from absolutely no use to even sometimes even beneficial use when it comes to substance use, to misuse, and ultimately to substance use disorder or addiction. And similarly, harm reduction exists along a spectrum as well, and it encompasses many approaches ranging from complete abstinence to reduce use to even safer use and safer supply. So all those things lie along the harm reduction spectrum. And thinking of all these different spectrums, I can't help but think about the treatment spectrum when it comes to addiction treatment. And harm reduction should be an integral part of the treatment spectrum, spanning from prevention, intervention, treatment, and even after treatment. It's critical to recognize that harm reduction should not stand in isolation, but rather should exist throughout this entire care continuum. All right, so now we talked about the fundamentals of harm reduction. Let's dive a bit deeper into the evidence behind it. And I want to emphasize today that harm reduction itself is evidence-based and that there are various types of harm reduction interventions that are firmly grounded in clinical evidence. So, what are those? So, for example, harm reduction has been shown to reduce overdoses, particularly through peer-delivered naloxone, which significantly decreases overdose deaths. Harm reduction also plays a critical role in preventing the spread of HIV and hepatitis C. So, syringe service programs, or SSPs, formerly known as needle exchange programs, those have been consistently shown to reduce transmission of both HIV and hepatitis C. And importantly for this audience, when SSPs are combined with medications for opioid use disorder, the impact is even greater, with significantly reduced rates of HIV and hepatitis C transmission. So, when you combine these things, again, integrating both these approaches really leads to better healthcare outcomes. And then also harm reduction has also been shown to influence substance use behavior. So for example, people who use fentanyl, if you provide them fentanyl test strips and they receive a positive result, they often modify their behaviors to reduce their risk, which is really important. The other thing is syringe service programs have also demonstrated further benefits beyond infection prevention. So they have actually been associated with increased treatment engagement and referrals, as well as reductions in healthcare utilization, including fewer emergency department visits for certain types of infections. So again, there is evidence to support providing these, much needed services to our patient population, and it's certainly based in clinical evidence and practice. All right, so we're getting to the tail end of this, probably the most important part. Now that we define harm reduction as evidence-based and patient-centered care, how do I do that, right? How do I put this into practice? And really, this is something I think I want to explore with you all today. So for MOUD providers, I see four practical elements to begin incorporating harm reduction into clinical practice. The first is to reduce stigma and center care on patient goals. We'll talk more about all these things here in a second. The second is to offer low barrier access to MOUD. The third is to prioritize overdose prevention. And the fourth is to support safer use practices. So I want to emphasize that language matters and practicing trauma-informed care is integral to harm reduction, like we mentioned before. So always use stigma-free language when talking with patients. So for example, say a patient has a substance use disorder, rather than using terms like addict, junkie, or alcoholic, you even feel bad saying those out loud. But similarly, say a patient has experienced a return to use instead of relapse. That's a better way of phrasing it. And really the thing about this is by making patients feel respected, they are more likely to feel safe and therefore share more openly with you about their practices. The other thing is to really focus in on the patient's goals, right? Patient-centered care. It's important to ask patients about their goals in treatment, even if their goals don't align with what you may hope for them. So I try to frame my conversations with patients in the following way. So the first thing I ask them is, I want to make sure you get the best possible care while you're here. Is it okay if I ask you some questions about your substance use? If they say yes, then I ask the following questions. What are your current goals around substance use? How much would you like to cut back? Remember, that's different from being an abstinent. What has been helpful in the past when you're trying to cut back? And are you interested in talking about medications for opioid use disorder or whatever substance use disorder they may have, overdose prevention, or safer use? By starting these conversations focusing on their goals, we build trust, align care, what really matters most to them, and creates a foundation for shared decision making with their treatment, which is really important. The other thing is, if a patient is interested in medications for opioid use disorder or mood, a key principle is to provide low barrier mood. So what does that mean? What is low barrier mood? In essence, it's about removing unnecessary obstacles so that treatment is as easy and accessible as possible, right? Again, directly aligned with harm reduction principles. So what are some examples of low barrier treatment? The first is offering MOUD immediately without delays. We all know that's the gold standard of care. This whole echo exists because of it, but we really should make it the first line treatment, making it readily available to patients. While counseling and other behavioral interventions are extremely helpful and important when it comes to substance use disorder treatment, we should make those optional, not a requirement to actually get MOUD. And continuing MOUD, even if a patient is using other substances, is really also important. The other thing to consider is recognizing that abstinence, again, is not the only goal, and reducing use and supporting safer use are valid and meaningful treatment goals. It's really important to think about. And also on that note, it's really important to celebrate any positive change that reduces harm, right? From that harm reduction lens, whether that's safer use, reduced use, or abstinence, right? I try to tell my patients every time, this is fantastic. I'm glad you cut back from 100 fentanyl tablets to 50 or whatever it may be. It's really hard to do that kind of stuff. And if you encourage them along the way, it really leads to better healthcare outcomes for everybody. Plus, it's just the right thing to do. All right, so let's talk a little bit about overdose prevention. Um, I'm going to acknowledge this is going to feel a little bit taboo for some providers since you may not be used to discussing these things that you're not fully familiar with or trained on, and that's completely okay. When I first began having these conversations with patients, it felt a little awkward recommending some of these interventions, but over time, as I continued to do it, it really just became part of my clinical practice and really the culture of the clinic I work at. And patients have been super receptive to this. So, when talking to patients about overdose prevention, here are some practical strategies to recommend. Okay. The first is try not to mix different substances, for example, like fentanyl and methamphetamine. And if you do that, try to use less of each. Avoid using alone or have someone check in on you. If you are using alone, leave a door unlocked or slightly open, or consider services like Never Use Alone, which we're going to talk about here in a second. The other thing I tell them and recommend is to do a test shot or to try using smaller initial doses, especially if they have a new supply. I also recommend to them that they develop an overdose response plan with their friends, family, or others who use substances too, again, just to keep them safe. And we also talk about considering other routes of use, safer routes of use. So, for example, if someone is using injection substance use, we talk about switching to inhalation as a potential option as well. And then lastly, we provide naloxone education, right? We teach them recognition of overdose, how to respond to overdoses, and how to administer the medication. Really critical when it comes to overdose, education and prevention. The key takeaway is that even one or two of these things, even small things, practical steps can really help out and save lives, especially when it comes to overdose prevention. And patients are often very open to these conversations when we approach them again without judgment. So just having a regular conversation about it, I think really helps out. So what is Never Use Alone? So this is a hotline. Here's the number here. But really what it is when you call, an operator will ask if you're for your name, location, and phone number. It's never tracked. But you then tell them while you're on the line, you call them, and if you use your substance and if you become unresponsive, they know where you're at, and immediate EMS is immediately notified, right? So that way there's a safer response in case they overdose. And I try to always provide this information to my patients, especially when they're just coming into the clinic for the first time. All right, so how to respond to an overdose. This is an example flyer that you can post or even hand out to patients. It reviews the recognition, response, and reversal of an overdose. So flyers like this are an excellent tool to guide discussions on overdose symptoms, the steps for using naloxone, and how to perform rescue breathing. I put these up all over the clinic. So again, it just kind of makes it an easier conversation to have. Sometimes patients will be like, hey, I saw that poster. Can you tell me a little bit more about it? And again, it just normalizes the discussion around these kinds of topics. All right, safer use practices. So when it comes to safer injection practices, there are a few key things that I wanted to share. The first, again, try not to share needles or equipment. That's one of the biggest ways infections are spread, and I tell patients that all the time. Whenever you can, use sterile water. Again, that helps prevent kind of infections from getting directly into the bloodstream. Clean the site before injecting and try to avoid licking the needle if possible. Again, all these things are helping reduce infection. If the shot hurts when you inject, pull it out. That usually means you're not in the vein, so that can also cause abscesses and other types of infections. The other recommendation that was new to me when I started learning about this is give your veins a break. So kind of rotate the injection sites, again, reducing that risk of repeated trauma in that area. Always inject with the bevel facing up. It's just a little bit easier on your veins when you do it that way. And if you're using with others, take turns so that things stay clean and safe as well too. And again, I always reemphasize, always keep a bottle of naloxone nearby just in case there is an overdose. Again, the goal here isn't to condone use necessarily. It's just to keep people safer, healthier, and alive, right? All right. So another key component is safer use supplies. One of the ways you can refer patients to get safer use supplies is to refer them to syringe service programs or SSPs, like we mentioned before. Again, these places not only provide access to sterile syringes and safe disposal, but they often provide complete, touch points for other medical services that are important as well, especially when it comes to substance use disorders, including screening for them, wound care, and even linkage to treatment and other supports that patients may need in this population. So really integral to like overall healthcare for patients with substance use disorder, especially those that don't typically reach out to the healthcare provider team. So in New Mexico, again, this is for New Mexico and other states, there may be other places to look for. But where do you find SSSPs here in New Mexico? There's a great website here, and all the links are going to be at the end of this talk, and I'll share it. And Rachel is always great about sending the links out at the end of here. There's this great website though, where you can just put in your location, your zip code, and it'll find the nearest SSP. So when patients are interested with this, I just say, hey, where are you staying at? What's close to you? And I kind of look on the map and I try to find something near for them and give them that information. The other thing about this too, as part of safer use and supply, you can also review how to use fentanyl and xylazine test strips. Again, the links to these resources will be provided at the end of the talk. These are directly taken from the New Mexico Department of Health. Really easy patient-facing, diagrams and language, easy to understand, health literacy level stuff. But really, testing for these substances is really straightforward. What you do is you dissolve a very small amount of the substance in water. You dip the wavy end of one of these strips into the water for 15 seconds. You lay the strip flat and wait a couple of minutes, and then you read the results, right? So one line equals positive for whatever substance that is, whether it's xylazine or some fentanyl. Two lines means it's negative, and then no lines means the test was invalid, and you can repeat that. And then if it's positive, again, just highlighting those safer strategies, having naloxone, don't use alone, go slow and low, avoid mixing substances. Those are kind of things that kind of piggyback whenever I provide this information to patients. And then another cool thing here in New Mexico is there's this drug checking system. So you can also educate patients about submitting their supply to the state drug checking system, which helps identify new contaminants. This is a really useful service, not only for patients, but also the community as well, as many of the updates that are released on drug trends, especially here in New Mexico from the Department of Health, come from analysis of these tests. So it kind of helps sets the tone of what's current in the drug supply chain and stream here in New Mexico. And this is one way that patients can help contribute to it. And then the other thing I wanted to highlight here is you can also consider handing out safer supply kits. So these are examples from the ABQ Punk Safety Initiative, which is a harm reduction project in part led by UNM medical students. Student Dr. Andrews on the call, and he's part of this, which is great. So one caveat, while these kits are available for free through the Department of Health and other nonprofit agencies like the Punk Safety Initiative or the New Mexico Harm Reduction Coalition, providers must complete DOH harm reduction training in order to distribute them directly. So those nonprofits can actually do it because they've done the training. But if you want to do it and give the training or provide these kits, you have to go through the training. The links for that will be at the end of this as well too. And then lastly, if you want to learn more about harm reduction, even in greater detail than what we talked about here, including the safer use of pipes, stems, and other supplies, the Graken Center for Addiction has an excellent YouTube channel that reviews many kit components, some of the things we just mentioned, and demonstrates for patients how they can use them safely. So I think it's a great resource to have. So again, these are all the resources I just mentioned. This will all be sent out to you. It includes a link to find the SSPs, the list of pamphlets for all the things we talked about in this talk, and the YouTube videos. And there's also a website here, if you're in New Mexico, on how your organization can access naloxone as well. And if you want to collaborate with a community partner, I think the New Mexico Harm Reduction Collaborative is a great one to do so, to kind of provide those kits if you don't want to do the training or just don't have the bandwidth to do that. So in conclusion, harm reduction reduces the negative impacts of substance use while respecting the rights and dignity of people who use drugs. It's evidence-based, shown to decrease overdoses, prevent infections, and lower healthcare utilization. You can integrate harm reduction into your MOUD practice by centering on patient goals, providing low barrier access to mood, emphasizing overdose prevention, and offering safer use resources. Thank you so much for allowing me to chat with you all today.